Well, thank you all for being here as we discuss this very important topic. I'm Jim Paschke, formerly with the Milwaukee Bucks, and we have Dee and Darvin Ham here today, two key members of the Milwaukee Bucks family. Darvin, of course, is an assistant coach, and Dee is his wife, and we're going to talk a lot about her today and with her. And I will go down the line and let the rest of you introduce yourselves. We'll start with you, Dr. Kong.
Hi, my name is Dr. Amanda Kong. I'm a professor of surgery at the Medical College of Wisconsin. I'm also the chief of the section of breast surgery.
My name is Diane Keller. I'm an occupational therapist, and I specialize in breast cancer rehab.
My name is Deanne Dupree. I am a nurse practitioner in plastic surgery.
Dr. Kong, let's start with you. How common is breast cancer?
It's very common. About 13% of women will be affected over the course of their lifetime. It's actually the most commonly diagnosed cancer in women in the United States. It is not the leading killer. It's the second leading killer after lung cancer, but it is the most commonly diagnosed.
When should women start having mammograms?
So actually, that's a great question. It's controversial depending on what group you ask. Here at Froedtert in the Medical College of Wisconsin, we follow the American College of Radiology guidelines. That's starting at age 40 and annually thereafter.
And obviously, an important question following that, how important is early detection?
It's really important because the earlier you find a breast cancer, the better their survival. And we've known that for many, many years.
And Dee informed me of something I found wonderful. She said, I'm a cancer thriver. Isn't that great?
It is.
How did you come by that?
Well, you find the positives of it. You don't want to keep speaking about the negatives. And as a thriver, you're just full of life, the energy. And I'm constantly looking for the positivity of it and cultivating that.
After your diagnosis, how did the folks here at Froedtert, which is wonderful, they're great, how did they help you deal with all of the issues that you have to go through?
They were absolutely phenomenal. With being diagnosed is a scary experience. You feel quite alone. I didn't know who to speak to. And ironically, it was during our championship run. Therefore, Darvin was busy a lot of the time, so he could not go to a lot of the appointments with me, so I was there by myself. So the Froedtert team became my family. It was them when I'm going into the doctor's appointments, when you're feeling emotional, when you're going through the pain. They're the ones, of course, they had the mask on, but as I was just speaking with my therapist, the occupational therapist, I could see your smile. I could see it every time I'm in there. And that was it. Every time I would come to the hospital for any type of treatment, it was always smiles, encouragement. Those days when I would even cancel an appointment, I'd have Dr. Kong, hey, I see you canceled your appointment. What's going on? Those signs of the fear just creeps in. And I can't do it right now. I can't. And it would just be like encouraging, yes, you can. Yes, you can. You can do it. I'm here for you. And that is what the Froedtert team is all about. They're just family.
And to give some of these women credit, I mean, yes, we can provide all these services, but I think when Dee talks about cancer thriving, one of the things I talk to patients about is keeping a really positive attitude. I think that's really, really important. It's a lot of the treatments we give are really difficult for people. And we understand that, but the one thing we can't control, we can give the medicines, we can give you hunks, we can make appointments for you, I can call you and harass you to show up to your appointments. But that positive attitude, I think, is so important in healing. I think you two can probably speak to it more than you both.
Darvin, marriage is a team sport, and support starts at home. So how did the Froedtert team help you help Dee?
Just the clarity, man. I tell anyone who has a spouse or family member dealing with this, like, being in basketball and sports in general, like, you need facts. You need actual facts. You know, we're not a speculative type of profession. And so the facts they were able to provide, and from, she went in for procedures, and it's like, they're walking me through everything that's going to happen, the time with something I pushed back, does she need to be in the recovery room a little bit longer, or how things are going during the actual procedure. It was like that, like clockwork. So just having that clarity was really extremely helpful. And again, like it's not an easy task, and when you then pull in a different direction, and you know, our jobs as Mrs. Prunty so eloquently said, like pulling us out of town at different times and doing different things, and I mean, we have this right here at home base, and you want to be there, and you want to be there as much as possible, but. And she's on the other hand telling me, no, you go to work. You know, go do what you need to do, go do this, just being a trooper about it. But, you know, you feel that sense of neglect as being able to provide some positivity, a good spirit, and just support, and having to be, you know, on the go so much. And it's such a high profile job.
You anticipated my next question, because you can't be on the road and have this going on and not think about it.
Oh, totally.
Who helped you handle that? I mean, I'm sure you do it as a couple, but it probably takes something from the outside too, I would assume.
Yeah, I would say my children, her mom was huge, my mother-in-law was huge, and just the patience you develop, understanding that she's going through what she's going through. You know, that C word is a scary word for all of us. But having an actual plan of action, it brings a little bit of stress relief to you. And so my job was then, you know, just to check in and just make sure she was okay, and be times when she wasn't in the best moods. And as a partner or spouse, like, you have to understand that and have that patience and just try to be a source of positivity and positive energy as much as possible.
Dee, when you share your story and experience with other women, how do you explain what Froedtert and the Medical College of Wisconsin have done and helped you, and what do you say to them as they move forward?
For me, it's been, I was actually referred by my neighbor to my doctor. And that is how I've been referring other people it's just like breast cancer, and it's just rising. And now I'm just referring, but let me tell you about my doctor. I have an amazing team there. Just contact this person. They're going to make you feel loved. You're going to feel phenomenal. This is the best hospital to go to. And that's how I've just been sharing it.
You've started a foundation.
Yes.
Tell me about that and how that furthers this cause.
Well, I started a nonprofit called Breast Assure. So it's breast and it's the assurance of knowing that you have love and support. So it's, as we spoke of earlier, it's more about thriving in the joy of social activities, because I was in that lonely state and I just wanted everyone to get out and let's just have a good time. Let's show our creativity. So everything that I usually create is about getting out, socializing with one another, having that joy inside and not any negativity. And we're not speaking necessarily about what's going on, what pain you're feeling, but hey, it's so great to see your beautiful face. How are you doing? What's going on? Let's have some fun. And that's about the nonprofit. And that's, as we left Milwaukee and we're back, I'm thriving more in that. And I liken myself, as I told my story before, I liken myself to Dorothy in The Wizard of Oz, but I say I'm Dee, returning to the Emerald City of Oz. It's just, there's no place like home. There's no place like home. And when I had to come back to Milwaukee, it was like, oh, great, I'm going back to my doctors. I'm going back to our Butts team, our whole family. So I'm just call me Dorothy now. Just welcome to back home. So just happy to be here again.
I love that, because we hear it all the time. There's no place like Milwaukee. There's no place like Froedtert and the Medical College of Wisconsin. And let's change gears a little bit. There are surgical issues with breast cancer. Ladies, can you fill us in on that and the therapy that goes along with that?
Hi. Well, we are the plastic surgery team. After surgical oncology meets with the patients and, establish a plan, our surgeons meet with our patients and kind of base our surgeries off of, what medically they can do, but also off of what the patient wants. So we do a lot of listening, and then we offer our services of which kind of breast reconstruction they can have, and that's a decision that they make together.
When is reconstruction typically done?
So in our system, most of our reconstructions are either done at the time of the mastectomy, or they can be staged a few weeks later after the mastectomy. We do have a process where if you had cancer treatment and you had mastectomies before, we have a delayed option too.
It's very interesting, actually, how reconstruction has evolved over time. So if you look back, you probably have grandmothers or great aunts or whatever. I think people have this concept of mastectomy. I'm always amazed. Patients come in, they're like, oh, you're going to take my breast off and my muscles and you're going to see my ribs. And I said, honey, we did that in 1970. We don't do that anymore. And so I think they're amazed because now we can save the skin. Sometimes we can save the nipple. You can't even tell that they even had surgery. And there's different kinds of reconstruction.
Yes, I was going to say, like, a lot of patients are just amazed that we can take skin and tissue from other parts of your body and move them out to your breast to, create breasts that way. We have implant reconstructions, and we also can do oncoplastic rearrangement where you would keep your foundation. So it depends on which type of lumpectomy versus mastectomy, which treatment you have.
Diane, what about therapy through this process and recovery time, that sort of thing?
Yes, I have the best job of everyone here. I just want to let you know, because when they walk in my door, I am the first one who's doing something to make them feel better, right? So we usually see people about 7 days to 2 weeks after surgery. So really early, we've developed protocols with breast surgeons and with plastics so that we can do early mobilization, get them moving, get their pain managed down. And then about 6 weeks, that's when we can do full strengthening and get them back to where they want to. Usually, I probably see patients for about 12 months, perhaps, and not 12 months, 12 visits, maybe about 3 months, but that take or give. So my goal for them, and I always tell them when they first have their first visit, my goal for you is to get you back to doing everything and anything you did before. And there's no reason we won't be able to do that. It's going to take some time, it's going to take some hard work, but you'll be able to do it.
Dr. Kong, it seems to me that it's pretty obvious that Froedtert and the Medical College of Wisconsin is a leader in this area.
Absolutely. I mean, I think what makes us special, so I am actually not from here. I'm an East Coast kid, but I've lived here for 16 years. And people always ask me, why did you come here? Or you didn't know a single soul. I mean, my parents thought I was going to go live in Laverne and Shirley, right? And when I came here, this building was actually not completely built, and they stuck a hard hat on my head. And they said, come walk with us. And I was still finishing my fellowship at MD Anderson Cancer Center, right? Number one, not Memorial Sloan Kettering, to Cancer Center in the United States. And I thought, I need to offer that same level of care to my patients. It's like if you've been driving a Ferrari for 20 years, how do you go to IKEA, right? So I came here and I met my future colleagues, and that's when we were smaller, right? And I thought, this is where I want to be in my waking hours. Like, there's so much potential here. The dedication, to cancer care, the feeling of we want to make it the best place possible. And so I signed up, and I was the black sheep that moved out into the Midwest with my family. And if you look at how we've grown over time, and we have 6 fellowship-trained breast surgeons from the top institutions. Here, we have fellowship-trained plastic surgeons. We have over 14 breast radiologists across the system that are all fellowship-trained. And fellowship training is very important. I mean, we're specialists. We spent additional training on top of our basic training just in breast cancer, and I think that's what really makes this place special.
Well, thank you for moving here.
I will say that people come from all over to have the care here in Wisconsin because of the specialists and how even just because of the fellowship training, the board certifications, and the types of surgeries we offer are not offered everywhere. So the plastic surgeries. So that's why I think we see a lot of people from all over the state and Michigan that come here for our surgeries.
And I would say one thing that, also sets us apart when we have fellowship-trained surgeons, for example, if there's a patient that's super complicated or there's a clinical trial that maybe we don't offer, even though we have a huge portfolio, right? Like we can call our mentors at all these places around the country, get opinions, and get the patients into like higher level centers if they really have to go there.
Judging by our conversation, I would suspect that Froedtert and the Medical College of Wisconsin gets 5-star reviews in this area. And thank you for all of your input today. Dee, I will give you the last word, but does anyone have a final thought before we go to our thriver? That means we covered it. Okay, Dee, what's the final word on being a cancer thriver?
Well, I just thank everyone. I thank everyone, the whole medical team. Like I said, from every day, just going in, and I would fly back to Milwaukee all the time just to come in to my doctors. I don't care when they set the appointment. I'm coming. What time? When is it? Okay, I'll be there just to see all of them. And it's amazing. And I don't think you gave yourself enough credit. You don't understand that therapy component, when you're not understanding that your arm becomes immobile, like you can't move it.
And you're right.
took
So
the
no one
time.
understands that, when I move my arm, people think about your shoulder joint, your shoulder muscles, right? And no one thinks about what is my chest wall doing. My chest wall has to move when I move my arm. So now you have this, pain, you've got scarring, you've got immobility across your chest wall. So that's what we spend our time doing.
A lot of cancer patients understand that the component of that, because when I left, I guess I stopped therapy a little too early, and I couldn't find a therapist, and it was just like I lost mobility in my arm, and it would just keep giving out. So you have to, kudos to you, and just give you more credit for that. But just the family support of everyone here, from the Buds organization, husband, kids, just everyone. I truly appreciate, just for people who are battling breast cancer, just to take the time for self-care, take the time to meditate, eat right, have patience with yourself, and love on yourself.
In sports, we're always looking for a bottom line reason something works.
Yeah.
I'm taking away positivity from this discussion. Do you agree?
Totally. You got to have the right mental approach to overcome anything. That's period. Just not just breast cancer, not just trying to win at the highest level, just every day in everyday life. It's all about your mental approach, and they've nailed that 10 times over.
Well, thank you. This has been a very important discussion, and I've enjoyed it. Thank you for the information. And of course, thank you to Froedtert and the Medical College of Wisconsin for their great work here and for making this discussion possible.